Well, the federal budget deficit is on everybody's mind, not only now, but it's going to be a key challenge for policymakers for years to come, particularly as boomers born after World War II enter retirement, and programs like Social Security, Medicare, Medicaid have to meet the needs of that aging population. So rising healthcare costs are at the heart of the federal budget deficit and are going to be at the heart of the solution. But the real solution is making sure that Medicare and Medicaid beneficiaries, and I would say every American, gets the right care. That means that they are able to get the care through a family physician when they need it, rather than going to an emergency room, a concept that's advanced by the patient-centered medical home. That they do not have avoidable complications or infections that either prolong their hospitalization or bring them back into the hospital. And that's why the whole notion of what's called a bundle payment or a single price for all of your care, including any readmissions or complications that occur, makes a lot of sense. There are also things that we can do to guide the right care by aligning physician incentives with those of hospitals and moving toward what's called value-based purchasing. And that means giving bonuses or rewards to those hospitals and physicians that provide the highest quality care. There are ways to make sure that people get the right care, but one of the things we need is more research on what really works. Is one drug really better than another? Is it worth paying 5 times as much for a new drug as for the current drug, say, to control your blood pressure? One important provision in a new health reform law is called the Patient-Centered Outcomes Research Institute, but it really commits funding to research to find out what works. Now, many people were afraid, oh, that's going to be a death panel. It's going to decide what you can have, not what your doctor can prescribe. But in fact, it's information for doctors, for patients, that they can use to help make better decisions about, is surgery really necessary? Is this drug really worth what's being charged for it? So comparative effectiveness research, I think, will help improve the performance of the health system. But we could go further. I think one disappointment is that we didn't link that to payment. We didn't say if the new drug is 5 times as expensive, we're just going to pay at the price of the old drug. And if you really want the higher priced drug, you can have it, but you have to pay the difference. So we didn't build in financial incentives to guide people to the best care, and that's an additional step that could be taken over time as we get more experience with that evidence.